having a little bit of technical difficulty with my internet, but we will be joining you with some guests for today. So welcome. Thanks for signing on. In the comments, please put your location that you're watching from. We'll be looking to see how far our reach has expanded. We usually get nurses from all over the globe who are joining us. All right. Do we have our guests signing in just yet? Hi, Mark. Can you hear me okay?
Hello, Holly. Good morning. Good evening on my end. I can hear clearly.
Okay, great. That's wonderful. And we do have, we do have Paul joining us as well, probably in just a moment. So today's show is really exciting because we are going to be talking about NextGen NCLEX. And since April 1st, we've met a few nurses who've actually taken the NCLEX exam in the new format with the questions, and they've had a chance to share their feedback with you and with me and with other instructors. And so we've got an opportunity, I think, in a few weeks where we're going to actually introduce some of them, but we had a lot of people working for this particular show during the time, and we couldn't get them to join us. So we're going to hope that their work schedules allow for it the next time. But we thought it was still important to share some of what we're hearing and learning, and maybe debunk some of the myths or information that's out there. So I see we have Modiin joining us from the UK and Jacqueline joining from the UAE. Welcome. Thanks for joining us today. So Mark, the first thing I probably need to do is we'll take a moment and do some introductions. So I'll start with myself. My name is Holly Musselwhite. I work with Kinetics USA, which is part of the AMN organization. And we work in International Healthcare Division with our partner company, O'Grady Payton. So if you see or hear either of those names, we are with the AMN organization. And working with international nurses from all over the globe, all different backgrounds, learning a lot about how things are working and what things are important to nurses as they prepare for their NCLEX is a passion of mine and probably a passion of yours given the position that you have. But I am a clinical nurse educator for Kinetics. And so in my role, I get to work with nurses who are prepping for the NCLEX. I get to work with nurses who are getting ready to come to the US and who are trying to prepare themselves for the challenge of the clinical transition they're going to face. And then I also work with nurses who are already here and are working and are experiencing that transition. And it's always been a very fulfilling, rewarding career for me. I really enjoy it. So I want to give you, Mark, an opportunity to introduce yourself. So I'll leave the floor to you for a moment to go ahead and tell us a little bit about yourself and your role.
All right, Ada, thank you. So I am Mark Luis Aspa, and I am the current program administrator of IPAS Online Review and Mentoring Academy. So I started as a success coach with IPAS and um, did some other things, and currently I take care of everything. And then also, as you mentioned, it's like I'm also like you. We really have this passion to really help our fellow nurses because hearing their stories whenever we do our coaching sessions with them is you can really empathize with the struggles that they have with their NCLEX preparation, and then you can get a better understanding of what the things they're going through. And I mean that serves as a drive for us as well to really work hard and provide all the support that we can have for our students for them to be able to pass their NCLEX in their first try.
Right. So, Mark, when we talk about the NextGen NCLEX, I think that the biggest problem we had as instructors and support systems for these nurses is we know what's coming, but we don't know what the impact is going to be prior to April 1st. Now we have some information. We have some people who've experienced it. They're sharing their stories with us, and it gives us a better understanding of the reality. So I've had the opportunity to speak with nurses who work and were educated in the US. They have some similar fears. So anytime exams change, it's scary. You don't know exactly how it's going to play out. But with the international nurses who are facing this change, the additional concern is most of our nurses are already in practice. They're already out in the field, but they're in a environment that may have different practice norms. And so one of the things that we heard was, get ready, case study questions. They're going to be long and challenging, and they may be stressful. And people are like, well, I'm already stressed by the NCLEX. Now what? So as we face that, you know, I think that it's been reassuring for me. I don't know about you, but I'm hearing good things. And it's nice to see. I think of the 5 nurses that I have under our umbrella that have tested, all 5 of them so far have been successful. And I think we have a recent tester that I'm pending results on. But when I'm looking at that, I'm like, okay, this is, this is pretty good that we're seeing some successes early on. The difference that I see with some of those nurses versus the nurses that I spoke with prior to April 1st is that many nurses that I know said, I'm scared about the next gen. And if I can test, like if I have permission and an ATT and there's a spot, I'm going to test. I'm going to take that test. And unfortunately, some of those nurses probably could have used a little more general preparation and some work on their testing strategies and question approach. But they wanted to give it a try just to see if they could not have to deal with next gen NCLEX. The nurses that are dealing with it, though, as I said, they've shared some things with us. We're going to share those things with you, and we're going to continue to gather information. Obviously, the more nurses who take this test, the more comprehensive the picture becomes of what you're really going to be dealing with. So I'm just going to take a moment, Mark, and look at who else has joined us. So Arlene's joining us from Jamaica. Hi, Arlene. Thanks for joining. Mildred from Dubai. Kosua from, well, actually it says Irene. So I'm not sure, Irene, where you might be signing in from. And Bev has joined us, and Gulf Fam. Let's see. Looking at posing a question here, so we'll get to those. But yeah, keep telling us where you're signing in from and what you're working on. We will have some time for questions as well. I see Dr. Nurse Paul has also joined us. So good morning, Dr. Nurse Paul. We have done some introductions for Mark and myself. So if you want to maybe just quickly introduce yourself and a little bit about what you do and what your background is, that would be great.
Thank you, Ali. Good morning, everybody. My name is Paul. In social media, my name is Dr. Nurse Paul. I'm the CEO of Aspire RN and provide NCLEX review. Been in the NCLEX industry for 16 years. I currently work here in the United States as a nurse practitioner. I'm also an NCLEX instructor for my company. I've partnered with Kinetics USA for NCLEX review programs and scholarships. So if that's something you're interested with, you might want to give us a call or send us a message through Facebook, Kinetics USA and Aspire RN.
Yes. Thank you, Paul. We're glad you're with us today. We were just kind of just getting started. So I'm going to share that we have Alexis from the Philippines has joined us. Another nurse says she's signing in from Texas, Saudi Arabia. We have someone on Facebook that says hello to you, Paul. So that's nice. Okay. So just really quickly, Paul and Mark, let's talk about what next gen NCLEX is. So Mark, I'll have you go first and just share with us kind of the changes that the nurses are facing from the previous exam model to the current, or what we call next gen NCLEX.
All right. So, hello, Doc Paul. Nice meeting you. And obviously, speaking of Holly, from what you said earlier, is like, of course, the anxiety towards the new format has already been there. I mean, with with what we experienced at IPAS is that the amount of students that we had who took the exam last March actually almost tripled from our average on a monthly basis. So it's really an indication that they're really afraid to take the next gen NCLEX. Okay, so they were all cramped to the month of March, and then here comes April, and then the amount of students who took the exam and like are scheduled to take the exam this coming April on our end, it's almost just half of what we had for March. So the good thing here is that with the one of the changes really that our students made, and of course the approach that we tell them to do with regard to the next gen NCLEX is that to really focus on the concepts first, and then before jumping into practice questions, because we noticed with the initial questions that we encountered from the NGN through UWorld and both Archer, is that it's really heavy on clinical application of the concepts. But of course, it's going to be difficult for the students to do practice questions without yet doing concept mastery. And the scores that we see from our students tend to be on the lower end of the average, because for those who really wanted to take the traditional format of the exam, they tend to rush their preparation. So um, unfortunately, majority of those who only prepared for like 2 to 3 months, they didn't really had good results yet. But those who waited and gave themselves enough time, and then they really didn't care if they're going to take the next gen NCLEX or not, they actually had good results with the initial batch of students that we have who took the next gen NCLEX for the past 2 weeks. They actually performed well. For example, on the first week of April, we had around four passers of NGN, and three of them just had the minimum number of questions, which was 85. So
Mhm.
it's really interesting to note. And when we look at the profile of the students who finished at 85, those were the students who attended at least two of the review cycles that we give at IPA. So it's really an indicator that when students are focusing on the concepts first before jumping into practice questions, they really have a high chance of passing the NCLEX, whether it is traditional or the next gen format.
So, Paul, I would like for you to share a little bit of what you're hearing and seeing as well. So we've had some passers, both from Aspire and from IPAS and from another partner organization. I don't know. We may have lost Paul actually. So basically, to echo what Mark is saying, we are seeing people pass that they were either not worried about the fact that it was next gen, or they were determined that, you know, I don't have the time, or I'm not quite ready to test in March before the change. So I'm going to knuckle down and work really hard to make sure I understand what the new test plan, or excuse me, what the new test question styles look like, and practice those. And so, Paul, we were just wondering, what differences with the next gen NCLEX that we have nurses preparing for. They may or may not understand that if they're on this web show and listening in. So can you tell us what you're seeing or hearing now that April 1st has come and people are starting to take these exams? Is it, they're feeling more positive for what you're seeing, or kind of mixed feedback?
Yeah, thank you for that. First, I apologize for my connection if it's spotty. I'm in the hotel here in Seattle for a weekend. But with the students that took the next gen NCLEX so far from Aspire RN in our review program, we've been seeing positive results. We have a couple of students who passed already. Others are going to be taking next week, this week to through next week. So we're positive that they're going to be having a good result. In Aspire RN, we did master classes and all that, so I'm confident and comfortable with their preparation. Of course, they talked about the next gen NCLEX question styles, right? Like your drop boxes and all that. Of course, that came out. There's case studies with a couple of stuff or situations that came out for them, and it's mixed topics. There's L&D topics, there's medical surgical topics, but mostly those topics are stuff that we've gone through during our case study reviews in my next gen NCLEX master classes for my students. So my students are quite positive. I did get a feedback from one of our pastors from Kinetics USA that it was he had a hard time. Like he thought it was going to be okay with next gen NCLEX case studies, but it was hard for him. But you know how it is, Holly, because it's computer adaptive for us educators. That means he's a high performing student because it was getting hard questions. And sure enough, he passed the NCLEX shortly after that, and we already got his results. He couldn't join today because he's working, but mixed results. But so far for my students, because I'm also watching social media to see what nurses who took it from the U.S. side, educated here, have been saying. But mostly for my students, I'm pretty comfortable. They were okay taking the NCLEX. But that's it. I guess preparation is very important with next gen NCLEX.
Yeah. And Mark mentioned, and I know you've mentioned it in a lot of your talks, that content being solid before you start trying to dig into these questions is really important. So some nurses have the idea that they won't do as much content review because they can learn as they go through the questions. And the problem with that is the questions that are on NCLEX may be different content or may have a different emphasis. And so if your assumption is, I'm just going to do a lot of questions and then I'll know the content, you kind of don't have a good approach. It's probably not going to help you get where you need to be for most nurses. Those who are looking at, I'm gonna make sure I'm solid on disease process, on patho, on understanding how nursing concepts in the U.S. play out, what nursing advocacy is about, prioritization concepts. If you don't know how a disease works, you're going to have a really hard time applying that to a scenario that is in the NCLEX. And while you may see similar questions to what you did in practice from some of these organizations that are providing practice questions and Q banks, all it takes is one or two words being different and your focus has to shift. So build your content first, have that really solid, make sure you understand how the newer question styles work, and then work on practicing those questions and practicing your testing strategy, making sure that you are thorough when you're reading a question, that you're not reading into it, that you're not overanalyzing it, second guessing yourself, all those bad habits that we have to, that's what the practice questions primarily are for, is to train your brain how to think through and process those questions without making some of those mistakes. Do you still learn content? Absolutely. Absolutely. So we have, I guess, some nurses who might be looking at NCLEX opportunities from Pakistan. And they said it's very costly and no one knows much about the NCLEX. So that's what these web shows are for, is to at least kind of demystify the NCLEX a little bit for nurses overseas who come from all different countries. On a really basic note regarding costs, yes, there are costs to obtain your training documents, to get those evaluated, to pay to have a state board in the U.S. review those documents. And as long as your education overseas is equivalent to a U.S. nursing degree, an entry level, then typically you will get approval to take NCLEX. But once you get the approval, there's additional fees to register yourself with Pearson VUE, the organization that does the test. And then there's also a scheduling fee if you're testing in an international testing center. there's travel fees. So yes, it can be very costly, and that's why Kinetics and AMN and iPass and Aspire all work together to help nurses understand that. There are some opportunities sometimes if you qualify to even look at sponsorship for your study. So you're welcome to apply to kineticsusa.com/apply. We can actually help explore whether you might be qualified to go through one of our programs. And if not, we can usually direct you to opportunities to help you with that. All right. So getting back to, we've talked a little bit about, some of the things that we expected. So, Paul, I think you said, and Mark, both of you said like low numbers of questions you've seen with the people who've tested so far, that they're actually, somebody said completing an 85. So are all 85 of those questions scored? It's not a trick question, I promise.
Sorry. So for the 85 questions, that's our minimum items now. I discussed this in my show, the Dr. Nurse Paul show, but 15 of those are pre-test items. They are not scored. You do not know which of those 85 items are pre-tests. They are not marked. They are distributed all across the 85 items. So it really doesn't matter if you know which pre-test items are or which are not or actually scored. But 15 of them are not scored.
Correct. So that means that you have to treat every question as if it's going to be scored because you have no idea. The other thing is, I don't know with the debriefs that you've done, but case study questions are one of those potentially intimidating factors. So these case study questions, Mark, they have multiple parts to them. So can you describe the case study question concept a little bit to our viewers?
Yeah, okay. So basically with the NGN, it's a combination of the traditional ones and the standalone items. So usually standalone items comes during the case study types of questioning. And with the new format right now, it is mandatory that regardless of how many questions the candidate will be able to answer during their examination, it is mandatory that they should have at least 3 case studies with 6 questions each, totaling to around 18 questions. And with that 18 questions, that is where the bow ties come in. That is where the modified SATA comes in. That is the other new formats under the NGN comes in. And when I was able to talk to 2 of our recent passers who got the minimum number of questions, it was surprising that, and at least I'm happy to know that they're a little bit comfortable with the case studies because, as you mentioned, Holly, one of the really intimidating areas of the NGN is the case studies because, of course, for those who are not on the bedside right now, um, they might have some sort of insecurities on their capacity to really understand and apply what they know because of course when we say case studies is more of clinical application of the theory of the concepts. Now when I was talking to one of the students a few days ago, I was trying to know further about case studies. Surprisingly, for him it was a little bit easier because number one, the normal lab values are already provided in the case studies. So of course, one of the things that is challenging for most students is that they have to memorize those lab values and stuff. But with the case studies, the normal values are already there, so they know if the presenting numbers there are deviating from the normal values. And then I guess with the trail of thought, especially for the progressive side of the case studies, is that when you already know the like basic principles, like basic applications and management on the, like for example, the first 2 questions of the case studies, and then if it's a progressive one, so at some point you can already expect what's going to happen to the student given the new set of information given to you after like for a several number of hours. And then one technique that the student applied there is he really anchored his trail of thought from the initial set of information, and then he was already at some point the succeeding questions were a little bit easier for him because with the initial clinical thinking that he did on the first like half of the questioning, he was able to apply that to the succeeding number of questions. So surprisingly, case studies was not that intimidating based on the feedback of two of our students. So this is a good thing to note.
Yeah. Thank you, Mark. The other thing that I remember hearing from a couple of nurses I debriefed with was that they got one nurse had 5 case study questions and one had 4. So there were a lot of people saying beforehand, you're going to get 3, you're going to get 3. So keep in mind that some of those were potentially unscored questions. If 3 is your minimum, and you have what we call unscored questions, or sometimes they call them survey questions, meaning they're testing them out, you're not going to know which one of those 4 or 5 is the one that you're going to actually impact your test with. So you have to do your best with those scenarios. I did hear very similar feedback from the nurses I've spoken with, which is we love that the lab ranges, the normal ranges are provided within those questions, and that the scenario is built. You and I work with nurses, as I said earlier, who are already in practice. They're already out there taking care of patients. They've had experience with patient care. So when they think of a question, the old style questions, sometimes it's frustrating. You're like, I need more detail to know what I should do next or how I should prioritize. In the case study, you are given that detail, and then it becomes important to make sure that you recognize those cues and use them appropriately. I did have one bit of feedback that I think nurses could be prepared for, which is one of the nurses I spoke with said, I answered the first question of that 6-part case study. And when I got to the second question, I realized I had made a mistake on my first response. That happens where sometimes as the case builds, you might have one of those uh-oh moments, and you can't let yourself become overly distressed by that. If you do, then you may lose your focus for the rest of the case study that is still yet to be presented to you. So take a deep breath. Remember that because you might have realized, oops, on part 1 of that case study, I made a mistake by seeing the second part. Don't let that color what you're going to do for the rest of it. Just calm, stay focused, be methodical, and work through the rest of those questions in that case study, because they all have give you an opportunity to basically make up for that mistake. So Paul, one of the things we haven't talked about yet is the partial credit for select all that apply. Have you seen or heard anything about that particular change when it comes to debriefing or speaking with nurses who've taken the exam now?
Yeah, well, some of them, I'm sorry. A lot of questions still are in the SATA format, but because of the next gen NCLEX, all of those SATA formats are no longer going to be all or nothing scoring system. We're not going to use the all or nothing scoring system for that. We are going to use the partial scoring system where they get deductions for every incorrect answers that they check. So yes, there's still plenty of students who got SATA, whether it's inside the case study or a standalone question using the next gen NCLEX format.
Mm. And what I heard from the nurses I spoke with about that was that it actually helped manage their anxiety when they were facing SATA questions, that they could say to themselves, I don't need to overthink this question. I need to use good question strategy, but I'm going to potentially get some of these right and have some potential positives, even if it's a tough question. So I think that the common thing I hear is I was less nervous about those because I knew as long as I had studied decently and was approaching the question with good practice, I was probably going to get something positive out of that question. And controlling anxiety is important during the exam. We know that some people they get a little too anxious, and it kind of just colors that entire exam experience. And really, even if you're well prepared, if you're not managing that well, it can have a significant effect. So knowledge is power. Understanding what you're up against on this exam is important. We did have, I had some feedback from some nurses that said they were watching some of the videos that we have shared about next gen and question approaches and things like that. So they were trying to look at various resources. A couple of them mentioned they did use the NCSBN resources themselves to look at those practice questions and the explanations that were given by NCSBN. I will see if I can share some links for NCSBN in the chat in just a moment. So basically, I think what I want to do now is maybe share some tips. So Mark, is there any specific tip, just one to start with, that you would give nurses who are scared about next gen NCLEX? And then Paul, will have you go next.
All right. So, well, basically, number one that I can advise is that never be scared with NGN, because at the end of the day, whether it's NGN or the traditional format, you still have to pass the exam for you to be able to go to the United States. And for those of you who are just who are planning to start with their NCLEX journeys, it's really important. You have to know yourself. You have to know the limitations that you have right now in terms of the thing that you're going to do, because and preparing for this kind of examination is really demanding in terms of time, in terms of resources, in terms of effort. And usually one of the um, challenging part of reviewing for this exam for most of nurses is time management. And probably if you plan to embark on this journey, you have to set to yourself that for the next few months of your life, it's going to be change. It's going to change a little bit, because you have to spend time with your concepts, your practice questions and stuff. And then, as I mentioned earlier, never rush into doing practice questions without really understanding your concepts, especially for those who graduated a long time ago. So that, because it's going to be really difficult for you to understand the rationalizations being given by those question banks, because um you, I mean, you weren't able to do a lot of critical thinking, because most of the time, if you don't know the concepts and you don't know the question, you don't understand the question, most of the time there, it's like you just have to guess the answers, and guessing is not really, is really low on critical thinking. So we always encourage our students to be patient, concepts first, and then after like 2 to 3 months, go to your practice questions, and then answer a lot of questions. And for those who are intimidated with SATA, I mean, one of the things that I really teach them is that to take note of the, for example, if they're using Archer or question or UWorld, is that to take note of the question IDs of those SATA questions, and then they can list it down. And then if they want to really spend the whole day just answering SATA questions, then at least they have a list or repository of SATA questions that they can answer again. Because there's no really shortcut to on how you can master SATA, but it really boils down to concept mastery and exposure to a lot of SATA questions. And of course, you have to find comfort in the idea that with the next gen that we have right now, you already have partial scoring with your NCLEX. So the pressure to get all the correct answers is not that really high compared to the traditional format, because at least this time you'll get partial scoring on the questions, on like the correct options that you were able to choose during the standalone items on the case studies and other things.
Paul, what could you share with us, a tip or two about prep for next gen and those people who are maybe really still anxious about it?
Right. So I've covered this in length in my own show, the Dr. Nurse Paul show, back in March. I gave a couple of case studies in 2 episodes for case study tips in 2 episodes. But back then, Holly, in our first show last month about next gen NCLEX, or I think that was last week or two, I said about, right, I'm not sure, I'm already like confused with the dates. But I talked about content, mastery of content. Now I'm gonna talk about practicing with next gen NCLEX questions. So while yes, you build your content, the second step to really making sure that you pass your NCLEX, and this was also applicable in the old generation, but now we're
Mhm.
just gonna be more focused in preparing for the NGN because of the new question types and new scoring systems that we need to be familiarized with. But practicing with question bank comes after content mastery, but it's also equally important. Familiarization with how the question would look like, how the question would be answered. There are different strategies that I teach my student for every type of NGN question with the next gen NCLEX master classes that I do. Very important that they keep practicing it because with this you build your test taking strategy, your facing for answering the exam, your way to manage your anxiety when your exam is time. You kind of like simulate what's going on within the NCLEX so you can prepare for it. The physical aspects, you know what you feel during the exam, and also you're also honing your comprehension and knowledge. You have to remember that next gen NCLEX questions, particularly the case studies, are probably going to be a little higher level. In Bloom's taxonomy, it's going to be usually application or analysis or evaluation level, and that's what's going to be tested. You have to remember that next gen is basically testing you with your clinical judgment skills. So the questions are always going to be clinical based, clinical reasoning. So you're going to have to think, what am I going to do as a nurse if the patient is right here beside me and this is what's actually happening based on the case? Now, for international educated nurses, a lot of our students, our scholars, are experienced nurses. So they already have clinical judgment. Yes. They already have critical reasoning. Yes. And that can be valuable during the actual NCLEX. Now, the only caveat there is their practice might be different to the American standard, which is actually what's being tested during the next gen NCLEX. So that is why you have your instructors teaching you the American guidelines, the American way of doing things, the evidence based medicine of how we do things here in the US. So, very important that you practice with next gen NCLEX questions. That's the only way for you to build your confidence, your comfort, and also improve your comprehension and analytical skills when it comes to clinical judgment questions.
Right. Great advice, Dr. Paul. Thank you. So I'm going to share just a thought to piggyback on that, which is I've spoken with a lot of nurses and they know people who've taken NCLEX, and now they're going to know people who've taken next gen NCLEX. And one of the things that we sometimes hear is I got notes from someone else and I use those notes and whatever. So you notice that we so far haven't talked about getting notes from someone. And so I want to address that really in brief. And I'll give you an analogy of where my concern would be if you put all your, we call it's an American expression called putting all your eggs in one basket. So this approach for study requires that or the best practice would be that you are, as we said earlier, making sure your content information, your knowledge is solid, making sure that you understand how these questions are formatted and how the test works. And when you do your practice questions, going back through and saying, what can I learn, not just knowledge wise from this question, but from how I approached it. Was I cautious in reading it, or did it look familiar? And so I just looked for a familiar answer. And maybe I missed the root concept that this question was particularly going for. And then you add in, well, I have notes from a friend or something like that. Those can be very helpful, but keep in mind that this test is like preparing to run a marathon. So if you're preparing to run a marathon, you don't read about it and then go run it and expect that you're going to be successful. It takes more than that. You don't want to just do short sprints to practice for a marathon. If you don't vary your terrain, if you know you're going to be running through flat areas, mountainous areas, whatever, if you don't prep for all of those variables that are going to come with that marathon, including the distance of it, then you're not going to be well prepared. So I would caution that when you're listening to advice from people who've sat the exam before, that doesn't devalue the importance of you knowing the content yourself and understanding it, and then being able to work through the practice questions without the influence of what someone else was maybe thinking. For me, note taking actually helps when I'm listening to a lecture and I'm taking my own note. It helps me cement the concepts that I'm hearing and maybe seeing on a screen. So that activity of taking my own notes also helps me retain that knowledge a bit better when I'm listening to lectures or watching videos with different visuals and whatnot. I do have two pieces of advice from one of our nurses who passed and couldn't be joining us today, but said, yes, I'll send you some tips. So number one was make sure that you are familiar with your test taking strategies and your question approach or your best practices so that you understand the questions well, and you can then determine what it's looking for. Don't rush to click next. So there's a reason for that advice from this particular nurse, because she actually experienced the previous exam, and was not successful. So the next gen was a retest opportunity for her. And one of the changes that she made between attempt one with the old way of doing the test and the new changes was realizing that when she was using practice questions, and even on the first NCLEX attempt, she was worried about the amount of time. So her time strategy was, I need to move through these questions at a pretty good clip, because if I have to do all of the NCLEX questions, if I take too much time on the beginning of the test, I might not have enough time to finish all of the questions I might be given. And that's a worrisome strategy. It actually probably cost her the exam the first time around, because when you're rushing through the questions, you may miss certain important details that drive you to an answer that's not the best answer. So that's where that advice comes from. And I think it's good advice. And the other piece of advice she said is kind of what we've been saying. Preparation is key. It's important. And you have a goal. Your goal is to come to the US. This is one step. It's a very important step, but focus on your goal. Your ultimate goal is to get here. And so the sacrifices that you may have to make for a few months, as Mark said, to prep for this will reward you. This exam does seem to have, yes, a certain amount of stress, just like everybody anticipated, but there have been some positives, and we want to emphasize that those are there. So we have nurses who've joined us from Saudi Arabia. We have Claudine and Abigail and Maisie and Belez and Bev and Krista all joining us. So thank you to you for joining and listening in, and tell your friends that this information is out there, and share the link so that they can watch and listen in as well with some of the things that we're hearing and seeing from the nurses we're working with who've successfully passed next gen. So the other thing that I wanted to talk about just a little bit, we had a show on this yesterday, but it's coming up. And before I get to that, let me just answer this question really quick from Mary. Mary, we do have at Kinetics USA on our website, you can go on and apply, or tell a friend to apply for a medical laboratory technology vacancy. We do place med techs in the US. So if they're interested, please go on to kineticsusa.com /apply. Sorry for that. And put an application in for that. I think we're going to pop the link up here on the screen for you as well. So the topic that I want to explore that's kind of in conjunction with next gen is retrogression. So retrogression has been announced through the latest visa bulletin. We know that if a nurse's visa priority date was after June, is it June 22nd, Paul, of last year? I know it's June 2020. There we go. There it is. So here are your dates. So the priority dates did get a little bit of a backlog, so we are facing retrogression for additional locations. As you know, India and China were already the visa backlog has been significant for them. China moved forward a little bit, but the rest of the world is now at June 1st of 2022, so, and Philippines as well as that date. What that means, nurses, is that when your visa is filed, you are now in a queue. So when that date of filing or your what we call your priority date, when your priority date becomes current, then you will get to move through the final phases of the visa process. So we have some nurses who've been reaching out and asking us, well, if I'm pending NCLEX, what's the rush? Why don't I just wait and then I can, once the visas are current again, I'll take my NCLEX and then I'll get filed and I won't be dealing with retrogression. So it's important for us, I think, to mention how this impacts nurses who are pending NCLEX. So Paul, would you like to speak a little bit to some of the things that nurses need to keep in mind when they're considering, should I delay my NCLEX because of retrogression or should I keep going?
Right. So I was in the show with Tanya as well yesterday with the immigrant lawyers, and I shared a couple of things about preparation for the NCLEX in relation to retrogression. Yes, there might be retrogression, and people have heard of it. And you're thinking, should I delay my NCLEX preparation? Should I delay my review? Should I delay my exam since we're running out of visas and there's not a lot of visas left for this year, so nobody could proceed. Guys, the people that are affected by the retrogression are those people with interview dates or are already in consular processing, which doesn't happen usually after 6 months to 1 year after your petition or immigrant petition started. The very first step for getting to the U.S. and even Canada is to pass your NCLEX. So even with the retrogression, you want to keep continuing with your plan to take your NCLEX on time because you want to get that NCLEX passed as soon as possible. The sooner that we can get your NCLEX, the sooner that your lawyers can start your immigrant petition, and the sooner that we can dock your paper to the immigration services. That way, as the visas become available and the priority dates or current dates in your visa bulletin progress, you will also have that ability to be included in those process whenever we get your priority date. So to cut it short, to summarize it, you should not be affected if you're planning to take the NCLEX, you're in the process of reviewing with the NCLEX, or you're about to take your NCLEX soon. It should not affect you when it comes to retrogression. Visa immigrant petition filing is not affected by retrogression. It's only those that will be having their interview next month, in the next 2 months, that are actually affected by it. So keep doing what you're doing, continue what you're doing, and you want to finish all your documents and requirements as soon as possible, because the sooner that you can get it done, the sooner that you can get here in the United States.
Thank you, Paul. That's great advice. And I think if there were nurses here who were wondering, you solidly answered what we should be doing. So the goal is to get you into that queue sooner rather than later. And the other concern I think we would have is you're not meant to be a perpetual NCLEX student. So if you start studying and then you have a gap in studying and then you resume later and then you have another gap and whatever, these ups and downs, it's not good for NCLEX prep. What we need to see is, just like I talked about with running a marathon, you don't want to prep for a short time and then let yourself become deconditioned and then try to recondition yourself and prep some more and back and forth. So if you're on the journey, stay on it, finish the program, get your NCLEX done, and start working with your partners, your visa sponsors, to get your visa filed and moving through the process. If you're considering whether to begin the process or not, the same thing applies. Get started, get studying, stick with it, get through it, and know that the nurses who have done an appropriate comprehensive review with the elements that we've spoken about, they are prepared And thus far, we're seeing good success with those nurses. Preparation is key, as John Liu shared with us during her debrief. That is important. But also, you know, if you have anxiety, learning about the test, learning how it works, and then preparing accordingly is what you do to prepare for the marathon, as it were. So Paul, what do we have coming up next? I think in terms of shows, might be some more. I know we will have a future Next Gen NCLEX one where Mark, some of the nurses that worked with their iPass, and Paul, some of the nurses who work with Aspire, we're hoping will join us and share their stories directly with our audience. We have done our best to sort of summarize today some of the good things that are coming through. So we will continue to share as we hear and learn and get data around this. I just got word today from actually a friend who's a US new nursing grad. And she said, oh, I had to retest with NextGen and I passed. So I started my day with some good news from a personal friend who was excited. The biggest thing out there is believing in yourself, feeling confident that you've done the prep that you needed to do. And, you know, a lot of us, we have a support system around us, but because we're nurses, we may often be the leader of the support system, right? So we're caregivers. We tend to look out for those that we care about and love and our families. And so sometimes when that family member says to you, well, what are you doing? And how can I help? There are ways that your family can help. They can help support you and encourage you to take that time to study. Maybe they're the ones who make the dish for the potluck dinner that you're going to have on the weekend with the family. Maybe you don't spend the time cooking this time around. You're doing some extra study in there, but looking for ways to bring your family together and know what that experience is. One of my nurses who just passed said, my daughters kept asking me, Mom, did you pass? Did you pass? And she said they asked what percentage of questions she got right, because that's their understanding of testing and passing. And she said, nope, it's pretty much just pass or fail. And I passed. So even your children will be feeling the impacts of your preparation, but also the results of what happens when you're successful and you're getting ready to help bring them to the U.S. to start their experience of living here in this country, and you begin your nursing career here. So on a final note, Paul and Mark, I'd like for you to just kind of share any last advice or words of encouragement with our groups here. And Paul, I'll start with you, and then Mark, I'll let you close it out.
So I'll just make it really quick. Don't be scared with Next Gen NCLEX. With the right preparation, you're going to be able to pass the exam, the Next Gen NCLEX exam. I know it's scary at the beginning with all these changes. Changes are always scary, but again, right preparation and right motivation really helps with your preparation of the NCLEX. So partner with the right people. This is your investment for the future. So you gotta be focused with it, but don't be scared. We're gonna be here to make you feel comfortable about the exam and be confident about yourself and your preparation.
Thank you, Paul. Mark, any last
Uh,
advice from you?
well, I mean, just to set the expectations of those who are not starting with their NCLEX yet. I mean, preparing for this kind of examination is really difficult. As Holly said, this is a form of marathon. Really cannot have that concept mastery in just 1 to 2 months. Mm, that's the reality of it. It's really going to be difficult. You have to have a lot of sacrifices, personal time, social exposure, and other things. And of course, along the way, most of the students get tired with the long preparation for this exam. And we always tell them, if you're tired, just rest a little bit and then pick up yourself again. And of course, one of the huge challenges here is procrastination. It's always there. But at the end of the day, you should always go back to the reason why you started this journey in the first place. You have to go back to your why, so that whenever you feel tired, whenever you feel discouraged, always go back to the very reason you started this anxious journey. Because of course, at the end of the day, when you already read deep, the word pass in your peers of your result is all going to be worth it. It's one of the me personally is like it's one of the best days that I had during the pandemic. So it's something that you should also look forward to. And of course, as Holly said, I mean, your family will feel the impact of the success that you will gain with this kind of examination. So just go for it. Okay, just go for it.
So in closing, we have Elma. I see you mentioned you're from the Philippines. Thanks for joining us today, Elma. Josephine asks, do we have vacancies for CNAs? Those are certified nurse aides. So at present, I don't know that we have any openings. You can always go onto our website and apply. And if we do get vacancies and that's something you're interested in, then you would receive communication about that. So that's not a big volume for us, but we do have some nurses who have gone through that type of process to come to the U.S. Jana from Jeddah, Saudi Arabia, thanks for joining us today. And Arlene, we're glad you enjoyed the session and found it informative. So in summary, we still have like 5 minutes left. If you guys want to pop in any questions about NextGen or things you're hearing, we're happy to answer those. And you know, if we can't cover it today, maybe we can also get it ready for a future show. So we're always looking for information on what you are worried about and what you are struggling with and how we can help you to navigate those challenges. Again, if you want to apply, if you're interested in doing a program, our partners with Kinetics are IPASS and Aspire. So both organizations do offer a study program. You can go to kineticsusa.com/apply and put your information in, and someone will reach out to you about the opportunities that are available to assist you with both NCLEX study, and in some cases, you might be able to receive assistance on your on your NCLEX applications or other parts of the process, even financially. What's most important is that when you're studying, your study progress is running parallel to your application for your NCLEX exam. So if you begin studying, but you don't actually have your credentials being evaluated or apply to a state board once that's finished and get your permission to test, now you've studied, but it can take months for you to get to the point that you get approved to take the NCLEX exam. So those processes are things that should run parallel to each other. Keep in mind that if you were to do the application first, you could have a similar problem. Depending on how quickly your application gets processed, if you begin studying after that, some applications are going to time out. So we want to make sure that you don't get too far into one process if the other one is not caught up. So we kind of run those simultaneously for that reason. Ruby Lynn, you're joining from the Philippines. Thanks so much for being with us today. And I have another user who says they're watching from CA, which I'm going to assume is California. So thanks for joining us today. And do you need to do IELTS to apply as a CNA? So that's an immigration question, Josephine, but since it's in the system, I'll ask some of our immigration experts to come back and maybe share some more information with you on what's required if you're coming through on a consular green card process as a CNA. We got an IPASS student, Mark, who has joined us. And I think there was someone else who maybe Ian, who said hello to Mark earlier in the show. So I don't want to forget or miss that. The other thing is, if you look at the post, I need to grab and share the NCSBN materials with you. So we will do that as well so that you can look at your next gen resources straight from the NCSBN. We have some people who are, I think, not exploring that. They're watching a lot of different social media things out there. Some of those have good information, and they're even partners that we work with. And some are maybe not as good of a primary resource for you to be getting ideas and information from. So when you look at the at the National Council of State Boards of Nursing website, or the NCSBN, this is the organization that actually creates the items for the NCLEX exams. They also deal with other aspects of nursing professionalism here in the United States. In addition to the NCSBN writing questions and training educators in how to build programs to help nurses prepare for this. You will also see that they do not actually administer the exam. The exam is administered by Pearson VUE. So Pearson VUE runs the testing centers internationally here and in the US, as they are the preferred provider for NCSBN at the moment for administering the NCLEX exams. So I will pop those links into the chat in a little bit. I'm having some technical difficulties right now, so my apologies for that. Just going to double check and make sure we don't have any final questions before we close out here. And I know the basic website, I can tell you off the top of my head, is ncsbn.org. So Eric from Arizona, thanks for joining. And another user says, I just passed my NCLEX. Woohoo! Planning to go to the back to the hospital to make your experience current. Which route would you recommend? Get experience first or take IELTS and apply with an agency? So there are some agencies that will look at working with you while you're still pending your English exam. And so you can reach out and apply. Some of them, like Kinetics, even offers a study program for IELTS and some of the other English exams that are out there that are approved for both sometimes your state board of nursing has certain exams they will approve and accept. And also those same exams you would be looking to be approved for use with your visa screen. So we are telling everyone who's pending English, yes, go ahead and do your English exam, get that over with, but you don't have to wait to apply based on pending English. There are some agencies that will be looking for you to be currently working. And so if you apply and it's been a long time since you worked as a nurse, they may tell you to reconnect with them once you've actually started back to work. But that is an important step. Experience that's current in a hospital is going to serve you well and make you more marketable to hospitals and organizations that are looking for nurses who have that kind of background. So current experience in a hospital is highly desirable. And I would recommend that the sooner you can get started back, the better. But that doesn't hold you back from reaching out to different agencies and organizations that will offer sponsorship to see how much experience they need you to have, and then understand what their criteria are. There are a few hospitals, small number, that might be willing even to work with you when you don't have current experience, but obviously those are much more limited, and their programs, they still require a lot of personal investment on your part to make sure that you're working through the clinical transition, because it is going to be a lot more challenging. So thank you everyone for joining us today, and we look forward to more web shows where we will talk to you about next gen and things. But at the end of the day, don't be scared. This is not a scary thing. We're hearing good things from the nurses we've spoken to. We're hearing positives. We're seeing positive results, and we're very excited with that. And we will keep developing our programs and assistance to ensure that you have the tools to be successful. So thanks everybody. Have a good rest of your day. Take care.